What's up, everybody? Welcome and welcome back to my YouTube channel. My name is Grace Lynette. First, I want to thank you for the love you've shown me in my previous video. If you haven't watched, kindly consider watching. Also, I urge you all to consider subscribing to my channel. Also, remember to click on the notification bell so you get updated anytime I upload a video. So today's topic is quite interesting. Do you know what happens anytime you fail to complete your medication? Okay, basically that's drug adherence. So today we're going to discuss about taking your medication appropriately as directed by your doctor. And when the moment you don't take your medication in the right way, that is basically lack of drug adherence. So, what are the factors that make us not to comply, or rather not to take medications correctly? One, the most common one is lack of proper understanding. Yeah, this is a situation whereby when the prescription is, or rather the medication is handed over to you, you don't get to understand properly on the instructions of use, whether you should accompany it with food or stuff, the frequency, the number of medications you're supposed to take, also for the period you're supposed to take. Yeah, so I shortly want to take you through a few steps that enable you have a successful visit to the doctor so that you are able to understand how you should go about it. Okay, the first one is you should first identify the medical facility that you intend to seek attention from. So get to book an appointment if need be. If not, if it's just a walking facility, make sure you are timely. Second, if you need to get a companion to accompany you to the hospital, kindly make sure you do, especially if you are so if especially if you're so sick, or you feel you won't be able to go through the hospital process by yourself, or in other cases your doctor or other physician will recommend you to bring along a companion, make sure you do. The third step, you need to identify clearly your complaints, organize them in an orderly way. That way you'll be sure when you get to the doctor you're not going to leave out any complaints unmentioned. Yeah, the other thing, be sure to engage your doctor, be open, give adequate information regarding your complaints, or rather your issue, answer the questions where necessary. Also, it's very important whenever you are sent for investigations, maybe to the lab or imaging or any other type of an investigation, kindly ensure you do the test, or rather the make sure you clearly get the instructions, and if you don't, kindly inquire. Do not leave the doctor's room without an understanding of your condition, your medication, how long you're supposed to take, if you're supposed to come back for a checkup and all that. Yeah, the other thing, make sure that whenever you are given a return date, you have to come to go back to your doctor. Yes, whether you will have recovered fully or not, kindly be sure to return to your doctor. Yeah, so I believe if you follow those steps, you are going to have a good understanding by the time you're leaving the hospital. You'll be able to understand about your condition, how long you're going to take your medications for, and such kind of information. So I believe lack of proper understanding will no longer be an issue. Yeah, so the other one is whereby you encounter adverse or bad side effects from the medication. This is quite common with basically all kind of medications. So whenever you encounter this, you are required to go back to your doctor. You don't just quit the medications and stay at home or seek for other inappropriate means of curing yourself, but rather report to your doctor, because the moment you stop the medications and stay at home, you are at risk of the disease progressing or rather becoming worse. Yeah, The other factor also, we have cases whereby you go to hospital, you're given meds, and in like 2 or 3 days you feel like you are fully recovered, yeah. And yet, for instance, your dose was supposed to go for like a week or so, maybe 7 days. So the moment you stop your medications at maybe day 2, day 3, what happens? Your symptoms have subsided, yes, but you should always remember the causative organism of the disease is still active, yeah. So guys, what happens when you fail to adhere to your medications, or rather when you fail to complete your medication dosage? One, you put yourself at a risk of being sick for a longer period of time. This is because you have interfered with the healing process by taking drugs in the wrong way. The other risk, it's the risk of transmission in a case where your condition is communicable, or rather it can be transmitted from one person to the other. You endanger other people by putting them at risk of contracting the infection from you. The other effect is super infection. This is whereby you get an infection similar to the one that you are treating, but this time now it has more severe symptoms. If it was pain, you have more pain, more like basically more severe symptoms, right? So the other risk, which is the most common and dangerous, is drug resistance. This is a situation whereby drug causing microorganisms are not able to respond to a drug that was usually able to kill or weaken them. So when this happens, again, you will be required to get a higher class of medication of the condition, which is in most cases more expensive, while some are not even available. So that is it, guys. I hope we have learned why it's very important to adhere and take your medications in the right way for you to recover from your condition whenever you are ailing. So thank you for watching. Kindly remember to subscribe and click on the notification tab so you get notified whenever I upload a video. See you in the next one. Thank you.